Bismillahirrahmanirrahim. Dear students, so welcome back to my lecture number 35. In this lecture, we will discuss about the myasthenia gravis. Myoplasthenia. So it is myasthenia gravis is autoimmune disorder affecting 1 in 10,000 population reduction in the number of NM receptors. Its clinical etiology is development of antibodies directed to nicotinic receptor in the muscles and plate, the reduction in number of 1/3 of NM receptors. Structural damage to NM junction, neuromuscular junction. The symptoms are reported weakness and easy fatigabilities. The treatment is Physostigmine 15 to 30 milligram orally every 6 hourly, adjusted according to the response. Physostigmines less frequently updosing other drugs, corticosteroid, prednisolone 30 to 60 milligram per day, azathioprine and cycloprines also, plasma paresis. Myasthenia crisis is the acute weakness and respiratory paralysis, tracheobronchial intubations and mechanical ventilation, methylprednisolones, IV withdrawals of acetylcholinesterase, gradual reintroductions of the acetylcholinesterase, thymectomy is done, and the problem is over treatment with actual disease as the opposite treatment, diagnosis by various stress, tonsilline test, injection of eudroponium 2 milligram observed after half a minute, 8 milligram observed. And MG especially and myasthenia gravis crisis symptom will improve, and over treatment symptom it become worsens. The oral therapeutic uses of cholinergic drugs and myasthenia gravis is eudroponium to diagnose and Physostigmine, pyridostigmine and stigmine to treat to stimulate the bladder and bowel after surgery, beta-nicole, carbicol and distigmine especially to lower the intraocular pressure in the chronic simple glaucoma, pirocarpine and physostigmine to improve the cognitive function in Alzheimer's disease, rivastigmine, galantamines and denopazils. Physostigmine and belladonna especially poisoning, and cobra white. The pharmacotherapy of organophosphate poisonings, the sign and symptom irritation of eye, lacrimation, maybe occurred salivation and tracheobronchial secretion, colic, blurring of vision, defecation and urination, spalling, blood pressure, tachycardia, bradycardia and cerebrovascular accident. Muscular fasciculation may be occur, weakness and respiratory paralysis, excitement, tremor, convulsion and coma. And treatment protocol, decontaminations especially at the level of gastric lavage. If needed, airway maintenance is important. Supportive measurement for blood pressure and fluid and electrolytes imbalance. So specific antidote can be given in the form of atropine at the dose of 2 milligram intravenously every 10 minutes till dryness of mouth or atropinizations up to 200 milligram per body per day. Cholinesterase reactivators, Oximes, prilidoxime 2 PMs, cholinesterase inhibitors, and obidoxime diacetyl monoamines. Oximes have generic formula RCH double bonds, nitrogen with hydroxyl group. It provides reactive group hydroxyl to the enzyme to reactivate the phosphorylated enzyme million times faster. PM quaternary nitrogen in simple words you can say prilidoximes gets attached to anionic sites of the enzyme and react with the phosphorus atom at the stereotic site. It form oxime phosphate complex making stereotic site free. They are not effective in the carbamate poisoning. Its dose is 1 to 2 gram IV slowly. Intravenously it can be administered at the dose of 1 to 2 gram to up to 12 gram for 24 hours. This is a simple summary in which the biosynthesis of acetylcholine I have already explained, the distribution of muscarinic and nicotinic receptor which is distributed throughout the body, and the classification of anticholinesterase which I have already explained in my previous lectures, the mechanism or mode of action of anticholinesterase in aging, how aging is occur, the action of cholinomimetics on the eye, physostigmine, the difference between physostigmine and neostigmine, as well as the myasthenia gravis, what is myasthenia gravis and its clinical feature, characteristics, treatment protocols, neostigmine and its clinical uses, the use of europoniums, Oximes and Alzheimer's disease drug names. So dear, if you remembers, I have already explained these things in previous lectures. So this was a short summary which I have highlights the biosynthesis, the mechanism through which acetylcholine is produced, the neurotransmitter is produced, and its and especially the distribution of muscarinic and nicotinic receptor, and the basic classification of anticholinesterases and the mechanism of action of anticholinesterases, as well as, so all these things I have explained each and everything in detail. And thank you so much for watching my lecture, and this was the end of this chapter number 4, or you can say unit number 4. Inshallah, then I will start another unit or chapter number 5, inshallah. Thank you so much for watching my lectures, and now you should wait for my upcoming lectures. Thank you.